iTherapy Together families, we are now on week 6. Great job making it all the way to week 6. Our topics for this week are functional classification systems, and we have a new upper limb domain, forearm, and finger movements. So for functional classification systems, these were developed probably within the last 10 years by different groups around the world as a way for us to be able to communicate better with families and amongst ourselves on how children with cerebral palsy function and really focus on the things that they're able to do versus using the more generic terminology of mild, moderate, or severe to talk about what a child is able to do or has difficulty with. And so this first classification system you see here is the GMFCS, or the Gross Motor Function Classification System. It's a 5-level system. Level 1 is where the child has the most independence with mobility skills, and level 5, the child is the most dependent with their own mobility. For a child with unilateral cerebral palsy that affects one side of the body, typically the kids will be a level 1, 2, or a 3. And you can read through the descriptions, you can look at the pictures and kind of decide where your child is functioning and what they're able to do. This particular description is for children ages 6 through 12, but you can go to the CanChild website and you'll find full descriptions of gross motor or functional mobility before their 2nd birthday and look through those definitions. And then between their 2nd and 4th birthday, depending on how old your child is. They've done some studies looking at physical therapists assessing function and rating the child and their level, and then they ask the parents to also rate their level of how they feel like, what level they feel like their child would fit into, and they're very highly correlated. So you can look through them, see which one you think fits best for your child, and that will kind of give you an idea of as they grow, they typically will stay in the same level. Sometimes they may move up a level, occasionally they move down, but in general, the kids stay within the classification level that describes them best as they continue to grow over time. That doesn't mean that they can't make improvements or gains. They absolutely can, but just kind of their overall function typically stays within that classification level. The other one is called the MACS, or the Manual Ability Classification System. Same concept, but this focuses on the use of 2 hands together. And so it's not something that is their best, what they can do with their best performance. It's really typically how do they use their 2 hands together when interacting with different items within their environment. So again, your level 1 is your highest level of independence, and level 5, they have much more difficulty using their hands together. Again, for kids with unilateral cerebral palsy, usually they fall into a level 1, 2, or 3. So again, you can read the descriptions and see kind of what you think, how your child uses their hands. You're welcome to bring this back to us, and we're happy to discuss it with you as well. This classification is for ages 4 through 8, and then there's also the mini max, which is for ages 1 through 4. They're very similar, with the exception on the mini max is you account for development. So what you would expect a 1-year-old to do is different than what you would expect a 5-year-old to do. And so they're going to use their hands a little bit different ways just because they're developing over time. All right, our upper limb domain for this week is forearm and finger movement. So for level A, again, you're going to keep working on exploring items placed near the hand. So thinking about those pre-grasp motions where they're moving, they're pushing stuff away, they're swatting stuff out of the way. See if you can start to get those fingers to open and close. And I saw some of that this last week, and it was really exciting that I hadn't seen before from some of the kids. Work on placing items in the hand when their palm is up. So we're working on finger movements and then working forearm. The harder movement is getting that palm turned up. So even if you help turn that hand over and then you place something in and you kind of hold it in that position and you talk about it, that's a great way to work towards a level A if you're not seeing them do that movement on their own. For level B, work on opening and closing the hand to grasp a variety of objects. We've done that over the last several weeks. So if they have that active extension and flexion pattern with the fingers, keep working that skill. That's a great skill to work on. Work on moving the arm around once the item is in the hand We worked on that with hold, and so can they keep hold of it, keep their grasp pattern as they move, but then really cue them. Can you turn your hand up this way? And see if they can do it. And if they can't, you give them that prompt, you get it there and say, okay, I want you to hold it there, hold it there, hold it there, and see if they're able to do that. For level C, continue to work on refinement of grasp. So move from that big grasp pattern, start picking things up off the table, start isolating the two sides of the hand, do that pincer grasp. The smaller grasp patterns, again, are also working on finger flexion and extension. You can also work on things like pointing, flicking items. You can work on giving me a thumbs up with the other fingers tucked in. So anything that's separating, again, this side of the hand movement from this side are great things to do with the kids. And then also work on large range of movements for supination. So if maybe they can get to neutral, you want to work on getting the rest of that weight over. And so things like turning a page in a book, pulling a slinky over, making it walk down the stairs, putting stickers on the bottom of your puzzle pieces. So when they pull it up, like, oh, it's on the bottom, and they have to flip it over to do it. Digging in the dirt and scooping. You can scoop any of the sensory things, sand, dirt, water beads, dumping cups over, anything that moves the arm into a palm up position are great things to work on this week. So great job, and keep moving forward. This is week 6. We have week 7, which is constraint, and then on week 8, we move to all two-handed tasks. So keep up the great work, and I can't wait to see you soon.